Welcome to the deep dive. Today, we're jumping into some really fascinating, maybe even provocative material you shared with us. It's research exploring a proposed new concept in psychological theory, something called normative identity disorder, or NID.
Yes, it's definitely making waves, a big proposal. And our goal today for this deep dive is really twofold. First, get a handle on just how broad this proposed disorder is, look at its various subcategories, and maybe more importantly, trace the theoretical shift behind it. Because it's a pretty radical move away from, well, older psychological models.
Okay, yeah, radical seems like the right word. So let's set the stage. This isn't just some academic paper. It's being proposed for inclusion in what the sources call the TSM. And just so you, listener, are clear, TSM refers to the Treatment Standardization Manual. Basically, the handbook practitioners use worldwide for diagnosis and care.
Exactly. So proposing NID for the TSM is a huge deal. It suggests that behaviors and ways of thinking that maybe were previously seen as just normal, or maybe couldn't even be categorized easily, are now potentially being framed as, well, pathological.
It sounds like it's trying to diagnose things that were almost invisible before, maybe seen as just the way things are.
That's a good way to put it. The source documents really stress that. Before this NID framework, the symptoms it covers were maybe too scattered or too embedded in society to be seen as a specific disorder. This TSM proposal is really pushing for a redefinition of what a stable, healthy self even looks like.
Okay, so let's get into the definition then. What is normative identity disorder, according to these sources? What's the core idea if normative is the key?
Well, the central idea, the core symptomology, seems to be an individual's dependence on really rigid social structures, depending on them for their own sense of stability, their self-worth. The sources talk about it as an identity fixation.
Fixation.
Yeah, where your core sense of who you are is fundamentally tied to sticking rigidly to what society has, historically labeled as normal. And the disorder part comes in when challenging that structure causes significant distress or maybe leads to harmful behaviors.
And the scope seems massive. The sources list specific examples, specific subcategories, to show how broad this NID concept is meant to be. Things like heteronormativity, gender rigidity, and, interestingly, neuronormativity.
Right, neuronormativity, we should probably pause on that one. As the sources describe it, it's this rigid adherence to dominant ways of thinking, communicating, processing information. It often frames neurodivergence like autism or ADHD as, inherently deficient or maybe threatening or something that needs to be fixed to fit in.
So a fixation on the idea that there's only one right way for a brain to work.
Pretty much, a fixation on the typical brain as the only valid one.
And when you put that next to heteronormativity, the rigid structure around sexual orientation and gender, you start to see the pattern they're suggesting, linking these seemingly different societal norms under this one umbrella of psychological fixation, NID.
Absolutely. And it gets clearer when you look at the more complex syndromes proposed within NID. The sources go into detail on a couple of these.
Okay, let's unpack those. There was one specifically about racial fixation.
Yes, they term it white racialization syndrome. The sources define that as covering a whole range of symptoms, including this concept of white innocence, sort of a denial of systemic advantage or responsibility, and other ways of thinking or behaving, maybe even unconsciously, that maintain white supremacy. The core idea is that the person's identity relies on the stability, the rigidity of that racial hierarchy.
Okay, and the other complex example mentioned was ability fixation. That sounds like a very charged term.
Yeah.
How's that defined?
Ability fixation, according to the sources, is an identity rigidly focused on upholding normative bodies. It's centered specifically on seeing oneself as fundamentally non-disabled. The sources suggest this often comes with anxiety or fear about disability, seeing bodies or experiences that aren't the norm as somehow threatening to one's own self-worth. It sets up the able self as the only acceptable psychological state.
Wow, so these aren't necessarily separate issues. They can stack up. The sources gave an example, didn't they?
Yeah.
Make it more concrete.
They did. A pretty pointed one. They talked about the distress someone might feel if their self-worth is all tied up in, say, a white, non-disabled view of masculinity,
Sure.
relying very heavily on the binary gender construction for stability. If that construction gets questioned or challenged, the theory suggests the person experiences deep distress because their core identity is built on that fragile, rigid structure.
That makes sense. But it also raises a big question, one the sources probably address. If NID is about sticking rigidly to these really common social structures, doesn't that risk making almost everyone diagnosable? How do they draw the line between common belief and pathology?
That's a crucial point, and yeah, the proponents try to address it. They argue it's not just having these beliefs, it's the rigid reliance on them. It's about the impairment or distress it causes maybe to the individual, maybe to others around them.
So it becomes pathological
When adhering to the norm becomes like a psychological prison, basically, leading to self-defeating patterns or, and this seems key, behaviors that actively oppress others just to keep that internal structure intact. The argument seems to be that the very act of upholding these rigid systems is the source of the pathology.
Okay, that leads us directly into the theoretical underpinnings, because this is where it seems like a massive break from the past. Historically, looking back at psychology, even Freud, didn't early theories suggest these kinds of normative fixations were actually, well, necessary for society?
Exactly right. Historically, these rigid identities were often framed as part of the superego. They were seen as the necessary breaks, the societal rules needed to keep our more, let's say, chaotic or instinctive parts in check. Social cohesion depended on them in that view.
So individual discomfort was maybe seen as the price of civilization.
Something like that. The fixation had a purpose, a utility for the group, even if it wasn't great for every individual. But the practitioners proposing NID, they're throwing that whole premise out.
So what's the core of their counter-argument? What's the radical shift?
The shift is really about cause and effect, or maybe intent. This new perspective sees these fixations not as natural defenses or necessary social glue, but as direct products of historical power structures. The sources explicitly name patriarchal white supremacist capitalism.
Wow, okay, so they're arguing these structures were never actually about functional social cohesion for everyone.
Precisely. The argument is they were always about maintaining hierarchies, about power. The sources basically say that what was historically called social cohesion was often just another word for systemic oppression. So the distress felt by people outside these norms isn't their failure to fit in, it's proof the structure itself is the problem. It's pathological and oppressive.
And it's interesting who is driving this shift, according to the sources. It seems linked to bringing in different voices.
Yes, that's highlighted. There's a clear push to incorporate perspectives that were historically pushed to the margins, both in society and in psychology itself. We're talking about indigenous knowledge, experiences from gender fluid and non-binary practitioners, more input from female voices, Black voices, disabled voices.
Voices that might have experienced the pathology of the old system firsthand.
Exactly. Practitioners whose experiences were often pathologized by the older models are now the ones challenging the very foundation of what constitutes a necessary identity structure for a healthy society.
Okay, let's shift to the implications then. This isn't just theory, it's a proposal for clinical practice. If NID becomes a diagnosis, what's the goal of treating it? What's the so what?
Well, the motivation seems quite different from traditional therapy goals. It's very aspirational, very collective. The proponents seem to believe that if we could dismantle these rigid, oppressive structures, which they're diagnosing as NID pathology, society would actually be freer. They use the phrase free to relate and care for each other.
That completely reframes the aim of therapy, doesn't it? If the problem is adhering to an oppressive structure, healing has to involve changing that structure, not just helping someone cope within it.
Right. And that leads to the question of how you do that clinically. The sources suggest a focus on collective healing.
Collective healing.
Yeah.
What does that look like in practice?
It seems to involve therapy that helps individuals recognize and dismantle their own internal adherence to these rigid norms, sure, but critically, it emphasizes doing this through approaches that focus on relationality, interdependence, moving away from the focus on pure autonomy or self-reliance, which they kind of link back to those capitalist structures.
So less focus on the individual in isolation, maybe more group work or community-based approaches?
It certainly implies a shift in that direction. Settings where these rigid social norms can be looked at, questioned, and maybe redefined together. The aim isn't just to make the individual functional within the existing system, but to help them, and maybe the group, break free from the identities imposed by that system. It's about adjusting the collective, not just the client.
That's a huge ask for clinical practice. It's essentially asking therapists to diagnose and treat the social contract itself. It sounds like they're explicitly linking psychological health to social justice.
That seems to be the unavoidable conclusion from the sources, yes. The pathology in this NID framework isn't deviating from the norm, it's the potentially harmful, rigid adherence to the norm. And the ultimate measure of health becomes the ability to relate freely, to care, something they argue the current rigid structures prevent.
So just to sum this up for you, the listener, what we've unpacked here is this really profound shift in thinking. We started with a historical view, normative identity, as maybe the necessary defense, the Freudian supereduco keeping society in line. And we've moved to this new proposal, NID, which frames adherence to those same norms as potentially a disorder rooted in oppressive systems, something needing treatment for collective well-being.
Yeah, the fundamental insight, or proposal rather, is that pathology might not just be about individual deviation anymore. It could be the very structure of sticking to a dominant exclusionary norm that's being framed as the illness itself.
We've covered the NID proposal for the TSM, looked at broad categories like neuronormativity and ability fixation, and traced this deep theoretical shift linking psychology to socioeconomic structures.
Which leaves us with a really big question to chew on, stemming directly from the material you shared. If these NID proponents are right, and what we've historically called social cohesion was often just oppression in disguise, then what would genuine psychological and social health look like? What kinds of structures, built on relating and caring, not rigidity, would allow us to be truly free? That question, I think, captures the whole vision behind this challenging new proposal.